Hello everyone, it's a pleasure to meet you all today. I would like to share my experience treating diabetes and uterine fibroids with you. Tomorrow, I will be speaking about common cold and allergies. Let's get started with diabetes. According to Western medicine, diabetes is categorized as an endocrine and metabolic disorder. The cause of diabetes can be either low or insufficient insulin, or because of problems with insulin receptors. A problem with the pathway which allows glucose to enter a cell. These receptors are faulty, even though enough insulin is available. There may be a mutation causing insulin resistance, resulting in improper cellular response to insulin. In insulin resistance, cells are resistant to insulin. This is a basic introduction to how one gets diabetes. In Chinese medicine, diabetes is seen to be the result of emotional or organ imbalances. Of course, there are contributing external factors such as smoking or drinking. In addition to the various types of foods and the food additives, genetic alterations, chemical fertilizers, etc., it's scary to think about what exactly we are eating nowadays. My friend who owns a restaurant says that all dishes nowadays contain added MSG, artificial flavoring and coloring. This is a big problem today. I went to Liao Island on a missionary trip once. We ate a lot of lobsters on that trip. Everyone thought we would get gout. But the native people said they eat lobster every day since that's what they can catch. And nobody had gout. However, after the island was open for tourism, many different types of foods, including junk food, became available. From there onwards, people got gout. So the type of food we eat nowadays is a major problem. Another big problem is the number of meds everybody is on nowadays. Diabetes is non-existent in ancient Chinese medical texts. Some consider it to be Schalke syndrome. Since it's only described as a syndrome, it is not a disease and can be completely reversible if taken care of early on. So it's essential to start treatment early and not let the disease progress to the point of destruction of too many cells. Then it's not a difficult syndrome to overcome. You should start to treat whatever symptoms the patient presents with immediately. For example, thirst due to upper Schalke or middle Schalke with stomach heat or bowel problems. If you treat this early on, the blood sugar will change. You can even change blood sugar in acute cases. I had a student once whose mother fainted at the airport on the way to Japan. She was sent to the hospital where she stayed in the ICU for 3 days. She told me that her mother's blood sugar remained at 500 for 3 days and was completely unresponsive to insulin shots. I asked if her mom had a bowel movement. She said she had not had one for 5 days. I told her her mom would be fine. The key would be to let her have a bowel movement. It was Friday night. I said her mom should be out by Monday. She was really shocked that I was so confident when the MD couldn't even help. I gave her Da Cheng Ki Tang. The next day, her blood sugar dropped to 180, and by Monday she was out of the hospital. So the effect can be very fast for emergency cases like this. What do we need to focus on when treating diabetes patients? We are not aiming to treat type 1 diabetes or cases in which the cells have already been destroyed. For type 2 diabetes, we need to restore the cells to the point that they can react to insulin. Chinese medicine can treat type 2 effectively, but not type 1. Let's talk about Schalke. Jiao refers to fast digestion and that the patient becomes hungry easily. Ke means thirst with excessive intake of fluids. So the excessive consumption of nutrients causes rapid weight loss. The very first sign of diabetes is rapid weight loss. You may wonder then why there are so many obese diabetic patients. Those patients are usually deficient, have a lot of stagnation and a slow metabolism. They have what's called a phlegm-damp constitution. Edema is usually severe. They will have frequent urination, but scanty in amount. Diabetic patients are not necessarily all skinny. However, if someone says he or she lost 10 to 20 pounds in 3 to 6 months, without wanting to lose weight or having made any changes to their diet, you need to consider diabetes. Is that clear? Upper Jiao includes the lungs and the heart. In Dashi Shinfa, upper Schalke is due to lung heat. There is also a little bit of stomach heat, but mostly it's lung heat. It can be caused by an enterovirus, or it can be brought on by food poisoning or traveler's diarrhea. With heat in the lungs, there will be thirst with desire to drink. What should we watch out for in cases like this? These patients usually want to drink cold beverages to quell the fire. I had a childhood friend who always drank iced beverages, especially Coke. I always told him not to do this, but he insisted on it. At the age of 20, he became diabetic. So I want to point out the dangers of having cold drinks to you. Cold drinks aggravate heat conditions. You can use herbs to clear upper and middle Jiao heat. Yangming fire from the heart and spleen can create upper Schalke. Baihu Jia Ren Shen Tang is the best for this condition. This is a great formula for many disorders. My colleague did his PhD thesis on this formula. His paper won first place in the thesis competition in Asia. Guess what his research was on? Sepsis. Can Western medicine treat this? Usually not, right? But with Jimu and Huangbai in Baihu Tang, the fever can calm down rapidly and the condition can improve greatly. The success rate is 80%. Zhengzhang Jing has a lot of excellent formulas. Baihu Tang and Baihu Jia Ren Shen Tang are excellent formulas. Is the Ren Shen in Baihu Jia Ren Shen Tang red or white ginseng? Raise your hand if you think it's red ginseng. How about those who think it's white? Back then, it's just Shengsai Shen, dried ginseng without any processing. So the type of ginseng best used in this case is American ginseng. What ingredients are in this formula? Jimu, Shigao, and Shiyangshen to nourish lung yin and moisten dryness. It's a great formula for upper Schalke syndrome. What if we are dealing with middle Schalke syndrome? What symptoms do we need to address? Bowel movement issues. All gastrointestinal problems. If the patient shows hunger and excessive appetite due to stomach heat, you can use Xingwei San, Ganlu Yin, Ganlu Xiaodu Dan. But if the patient suffers with constipation and also excessive appetite, what would you do? We will use a formula from Wenyi Lun. Zhengyi Cheng Shi Tang to help promote bowel movements. Sometimes I use Runchangwan too. You will see the blood sugar level drop after a bowel movement. In lower Schalke, we are dealing with the kidneys. These patients will show heat signs. They have both yin and yang deficiency and will show tidal fever or low-grade fever. Normally, one must have upper and middle Schalke first prior to developing lower Schalke syndrome. So the three most typical signs of diabetes are polydipsia, polypepsia, and polyuria. When you see polyuria, usually the first two will be present as well. This is true in both TCM and Western medicine. Urine may be dark yellow or turbid. In such a case, you can use Wulin San. If urine is turbid, you are dealing with proteinuria. Or there may be a layer of oil in the urine. Due to kidney Jing exhaustion, these patients will usually have dark complexion and appear skinny. Excessive heat dries out the yin and the Jing. This is when you need to use Jibai Di Huang Wan, along with other formulas to clear either the upper or the middle Jiao fire or something to purge the bowels. Jibai Di Huang Wan is a must. Some patients in the later stages. Have you noticed that patients taking cardiovascular meds soon develop diabetes? This is because at the end of all diseases, yin and yang become deficient. What you should consider at this point is to use herbs that warm up the yang and nourish the yin. Some use Yougui Wan and Zhuogui Wan. I like to use Bawei Di Huang Wan with Jimu and Huangbai instead. Some use Bawei Di Huang Wan and Jibai Di Huang Wan. You can use whatever you think is logical and works for you. In the initial stages, you must moisten the lungs for upper Schalke, clear the stomach heat for middle Schalke, and tonify the kidney for lower Schalke. In addition, if the condition is chronic or has been there long-term, you need to take into consideration the presence of blood stasis. I will discuss how to use blood movers to lower blood sugar later on today. Schalke is a disorder of the qi, blood, and fluids. In stage 1, what will you see? Congenital deficiency of the organs. In other words, the patient is not born strong, but with weak kidney qi. Coupled with improper diet, including excess in quantity and wrongful selection. Diet is considered an outside influence. What about internal contributing factors? Emotional imbalance. What else? Another cause is overwork or excessive fatigue. The best way to treat this in the initial stages is to sleep. But let me tell you that watching TV is not the same kind of rest as sleep. What do you think is happening in your head when you are watching TV? It's still working. There is a very famous actor in Taiwan who had 3 strokes. While he was in the hospital resting and sleeping soundly with a blood pressure in the 130s, his nurse, out of the kindness of her heart, thinking he might be bored, turned on the TV for him. With the TV on, his blood pressure climbed to 200. He quickly asked her to turn off the TV. He said that all the news on TV are bad news. This is what I mean. Watching TV or checking your phone is not relaxing. It's all considered overworking. To really rest, you need to close your eyes and calm your shen. Exterior heat invasion, as in enterovirus or gastrointestinal infections, are all included. Another cause is heat, summer heat, or heat stroke. There is also another Chinese medicine term for this called Xia syndrome. Don't underestimate summer heat or Xia syndrome. 6 years ago, I had 3 patients who came in at the same time. All of them came for the same reason, anuria. One of them worked at the ICU and his family owned an herbal pharmacy. There is a special festival in Taiwan where we go to the temple to burn incense and pay respect to the gods. That day, the oldest of the 3 patients was in his 60s. The second one was a retired policeman in his 50s. The last one was in his 20s. They all came to me because they could not urinate. The patient in his 60s said he was too busy in the temple and didn't drink much water. He said he drank only about 600 cc of water that day. Reaching the temple requires a lot of climbing, so naturally one would sweat a lot. The first patient had high fever after the worship and became unconscious in the evening. He was sent to the ICU and received dialysis immediately to save his life. The retired policeman in his 50s is actually a friend of mine. That day he rode his bike for 20+ kilometers, going uphill. Altogether, the trip was about 40 kilometers. He didn't drink much water either. After he came home, he went to help his son move. He drank only about 150 cc of water in the car. By evening, he had blood in his urine. The last patient, in his 20s, went backpacking. To lighten his load, he only brought 2 bottles of water, each 600 cc. How many days was his trip? 3 days. After his trip was over, he couldn't urinate. All of these cases were summer heat strokes leading to acute nephritis. If the heat is not properly dispelled, it can affect various parts of the body and affect different organs in ways you wouldn't imagine possible. Many diabetic or hypertensive patients, after I perform gua sha, see an improvement in their blood sugar and pressure levels. I had a 40-year-old patient with 180 systolic pressure. I told him that he had a summer stroke. So I prescribed him Shen Ma Yin along with Xing Yi Shi Tang and Huo Xing Zheng Shi San because he had some GI symptoms. Only these 3 formulas. The following week, he came back and told me that after he took my herbs, his blood sugar, which is normally 180, dropped to 110. The blood pressure also dropped and normalized. He wondered why he had such miraculous results, especially since his MD had told him never to take ginseng. What do MDs know about ginseng anyway? It can be used for diabetic and hypertensive patients if your diagnosis is correct. Chronic diseases consume the body and cause deficiency. Before tonifying, clear heat first if there is any. Then use tonics like dongui, Renshen, Huangxi, etc. Sun Simiao told us how to prevent summer heat strokes in his book. Did you know? Before summer arrives, drink 3 rounds of Sheng Mai Yin. Have you ever been to Xi'an? Where was the capital during the Tang Dynasty? Xi'an, right? What do you think the weather was like during the Tang Dynasty? It was not hot back then, around 20 to 30 degrees Celsius. It wasn't that hot, and Sun Simiao wrote in his books that 3 rounds of Sheng Mai San was needed. With global warming and the hot weather now, how many rounds of Sheng Mai Yin do you think we need? I feel like we need to take a heavier dose now. If you live in Taiwan, I would suggest you take Sheng Mai San every day. Even here in Los Angeles, it's a desert, right? When you overwork or have heat invasion, it can lead to yin deficiency, heat of the organs. Many people like to drink ice water to quell their heat. Over long periods of time, Qi and Yin will both become deficient and fluid distribution will be disrupted. So why do some people experience more thirst even after drinking a lot of water? Cold or icy beverages, while it's not toxic, are very harmful to the body. Which dynasty started consuming icy drinks, popsicles, etc.? Shing Dynasty? No, earlier than that. I am not talking about ice that is used to preserve food. I am talking about popsicles. Interestingly enough, in that same dynasty, Wenbing febrile diseases started. Where was the capital of the Ming Dynasty? Nanjing. It's south of the Yangtze River, so it's hot. At that time, popsicles were invented. You can still see some of these popsicles in countries like Thailand and Cambodia. Ice with water and salt can reduce the temperature to -15 degrees Celsius. If you dip a wooden stick in soybean milk, you can make a popsicle. It's soft and a little chewy. It's also a bit salty from the salt, which is a necessary ingredient to reduce the temperature. During the Ming Dynasty, discussions on febrile diseases began when the temperature began to rise. Zhu Danxi's work was considered more important then. So was Schalke syndrome. Zhu Danxi was from Zhejiang Province, Lanxi County. These theories were mentioned in the Nanjing. However, it wasn't until the Ming Dynasty that it became popular. The reason for this was the invasion of northerners pushing the Chinese to move south. With the influence of Western medicine, the pathogenesis of diabetes became even more complex. It can be effectively treated in the initial stage. The main cause is yin and fluid deficiency leading to deficiency heat. Biao, meaning symptoms, is here. It can lead to ben, which is the cause here. You must treat the symptoms of heat first and address the yin deficiency later. The root cause is yin deficiency. The symptoms are those of dry heat. Why would one have yin deficiency? The cause is either prenatal or postnatal. However, do you think all diabetic patients are yin deficient? Have you noticed that there are plenty of kids nowadays who like to consume cold drinks, but their skin feels cool to the touch? In the evenings, they will take off their clothes and want to have the air conditioning on. They claim to be hot, and they slowly develop the inability to concentrate. Perhaps some tremors develop. What do you think Western medicine would diagnose this as? ADD or Tourette's syndrome. The cause? Too many cold and icy drinks. These kids often complain and throw tantrums if their parents don't give them iced or cold drinks. How do I treat Tourette's syndrome? By warming the yang of the body. I have 2 patients, twins. The younger brother looks like this. The parents told me the MD had diagnosed him with Tourette's syndrome. I told the parents to stop all iced and cold drinks. The parents said their kid always complains that he is thirsty. Do you dare to use interior warming herbs? Theoretically, if they are twins with the same genes, they should both have Tourette's. Western medicine loves to talk about hereditary diseases. Is this hereditary? Why does one have it, but not the other? The younger one of the two always eats ice cream after dinner. The older brother had to go to piano lessons at night, so he remained okay. 3 years later, both of them had the same condition because the older brother finished with his piano lessons, so both were having ice cream every night. I am not kidding. I told the mother that her husband needed to stop giving them ice cream or else the herbs wouldn't work. I have treated many kids with Tourette's. All of them had the same preference for ice and cold. The more cold foods they eat, the more yang deficient they become. Most kids will love iced drinks or ice cream, just like dogs love bones. The colder, the better. You will notice false yin deficiency signs. What's that? They will complain of heat and preference for cold drinks. However, their bodies feel cold. So which is it? Raise your hand if you think this is a yang deficiency. What about yin deficiency? Why would yang deficient patients show false yin deficiency signs? If I had a cup of water like this and I turn on the motor, what happens to the water? Water will be pushed out, right? What if it's a cup full of ice? Is that considered water? Yes, and it's full too. However, if I add some more water, it will spill out. The logic is the same with someone with cold. When they drink water, they will soon need to go to the bathroom to urinate. They usually don't like to drink water because they have to urinate. Zheng Zhongjing once said that there is a condition where people like to wet their mouths with water but don't like to swallow it. This is exactly what I am describing. They will spit out the water and not want to swallow it. In this kind of case, use as many interior warming herbs as possible. When the sun shines on the ice, it will melt and water will spill out. The patient's yin heat signs will improve if you use interior warming herbs. Many people are sick because they eat too much ice cream and consume iced beverages, etc. I am even talking about cancer. This may be one of the most important causes of disease that gets overlooked. Many diabetic patients tell you they are thirsty, right? They all like cold drinks, right? Most yin-deficient patients should only have a little bit of heat. Are they really that hot? Have you touched their bodies? Are they cold or hot? Most of them are actually cold, from yang deficiency. Over a period of time, they will become chubby. This is all due to yang deficiency. In the end, they will become both yin and yang deficient. You must warm up their yang first and tonify yin later. Schalke syndrome applies to upper, middle, and lower Jiaos, the lungs, the spleen, and the kidneys. Which organ do you think is the primary organ involved? Kidney. That's why you will see Liu Wei Di Huang Wan prescribed a lot. Did you know that this formula is considered evil by the National Hospital of Taiwan? Every 3 to 4 years, there will be a wife of a certain professor who will need dialysis due to taking this herbal formula. It's ridiculous because you can never find this professor. The hospital will release fake news to discredit Chinese medicine. Liu Wei Di Huang Wan is evil in their eyes because it is very effective and takes away hospitals' business. Western medicine feels this is a horrible formula. 5 major hospitals in Taiwan once performed research on Liu Wei Di Huang Wan and its effect on diabetes. Out of those 5 major hospitals, only 1 hospital had positive results. That hospital had no Chinese medicine department. Why was it that only 1 hospital showed positive results? They made differential diagnoses and prescribed Jibai Di Huang Wan, Ba Wei Di Huang Wan, and Liu Wei Di Huang Wan. The other hospitals wished their TCM departments never existed so they can take total control. So they only gave Liu Wei Di Huang Wan to everyone without doing differentiation in order to skew the study. Because of the differential diagnosis performed, the herbs effectively controlled the blood sugar level and quality of life of the patients. The success rate was about 80%. The other 4 hospitals had a 25% success rate. The low success rate was due to the fact that no differential diagnosis was done. As you know, Liu Wei Di Huang Wan is an important base formula. However, you have to modify accordingly. When there is retinopathy, or any sort of eye damage, such as macular degeneration, or in severe cases, retinal detachment, Shiju Di Huang Wan is the formula to use. If patients require eye surgery, due to macular problems, I had a teacher when I was still in school who specialized in visual disorders. He specialized in eye surgeries. He said that most eye surgeries for diabetic patients show no improvement. The reason is because the capillaries in the eyes are mostly dead. He would encourage the patients to take Shiju Di Huang Wan for 2 months prior to surgery and for another 6 months after the surgery. The success rate could be 80% or higher. Now you can understand how important herbs can be. For yin deficiency patients, use Jibai Di Huang Wan. For fatigue and edema in the legs, use Ji Sheng Shen Shi Wan. It's Liu Wei Di Huang Wan with Rogui, Fuzi, Niu Shi, and Qishanzi. The extra herbs are there to strengthen the back and knees. When you treat the liver, you must also treat the kidneys. It's true, even in Western medicine. Why is it that glucose cannot enter the liver? This would lead to excessive levels of glucose in the bloodstream. Hence, you must address the liver and the kidneys. Lower Schalke can affect the liver. It should be reversed. Liver dysfunction can affect the kidneys. Overexertion or overwork damages the liver and the kidneys. Liver yang rising can lead to lower Jiao fire. What type of urine would you see in a patient with Longdan-Zhi-Gan-Tang syndrome? Anybody? What does urine look like? Dark yellow with possible burning or heat sensations. Can Longdan-Zhi-Gan-Tang treat diabetes? Yes, especially in excess heat cases. Don't restrict your thinking. You need to sedate if it is indicated. Don't merely tonify. You can even help the patients who have been taking Western meds for 4 to 5 years. One day, I had a patient come to me complaining of dizziness. I asked him when the dizziness occurred. He replied that it would occur after taking the meds following his breakfast. What is that? Hypoglycemia. Low blood sugar. I told him to cut his meds in half. He came back much happier. His HbA1c was tested again. It was 2.6 and wouldn't drop. It then became 9-something, and half a year later, he was normal. He never had to take any meds for diabetes again. He was cured. It seems impossible, right? It is possible. In any chronic case, there will be yin deficiency with heat. Or there may be false heat with Qi and yin deficiency. Abnormal Chien-Fu function, along with fluid metabolism disruption, results in excessive thirst. This yin deficiency leads to increased thirst and hunger, and eventually to constipation. Have you noticed most diabetic patients have severe constipation due to impaired fluid metabolism? The first objective is to normalize their bowel movement. Both urination and defecation need to be addressed, or phlegm and blood stasis will form. This, in Western terms, is the cause of defective receptors. The signal pathway has problems due to phlegm and blood stasis. I discovered that once the stasis is removed, blood sugar will normalize. Most patients who have this type of blood and phlegm stagnation will suffer from foot problems in later stages. What are the early signs of diabetes? Itching? Then what? The skin can crack easily. Then there's neuropathy, which may finally lead to amputation. Don't underestimate the severity of this illness. There is a great formula called Huang Shi Wu Wu Tang. It's Guiji Tang minus Baishao with the addition of Huang Shi. It's mentioned in the Shan Han Lun and Jin Gui Yao Lui by Zhang Zhang Jing. This formula was originally designed for Shu Bi. Shu Bi is blood painful obstruction. Today, this condition is similar to what we know as Raynaud's disease. This is where the extremities lack blood flow and appear dark purple. I had a patient who was also a student of mine. He passed away now. He was a retired elementary school principal. Towards the end of my lecture, he asked if he could attend my class again if I held any future courses. I asked him why, and he showed me his leg. I could see his tibia bone. I could see his bone. He had no muscle, no skin. He suffered from severe diabetes. His MD wanted to amputate because there were no meds for it. I told him to give me a month to try to treat him. 3 months later, his leg was completely fine. He had only one wound, that of about 2 centimeters in diameter. Only this much was not healed. Everything else was fine. When he passed away 3 years ago, a student of his came to me and asked me if I remembered him. He told me that he had passed away from a coronary heart attack. He had told him to thank me because I had helped him preserve his legs so he didn't have to die with missing body parts. Historically, amputations of the legs would only happen if you are disrespectful to the emperor. MDs are performing amputations left and right nowadays. I feel like this act of amputation should be an act of God. It's horrible to have this type of amputation done. What formula did I use? I used Huang Shi Wu Wu Tong internally and Jin Chuang Gao externally for this patient. He also drank Huang Shi decoction every day. There are 2 types of Huang Shi, Jin Shi and Nai Pi Shi. I am not sure what's available here. Bai Pi Shi is also known as Bei Shi. In school, we learned that this herb is excellent to regulate blood sugar as well as drain dampness. I tried this while I was still in school. If I drank Bai Pi Shi or Bei Shi, I would have more urine output, but my glucose stayed the same. But if I took Jin Shi, my glucose would drop, but I could not pee. So what do you do if the patient has urinary problems in addition to diabetes? Alternate the 2 types of Huang Shi each day. That's what I did with this patient. Don't laugh, I am serious. Such a situation is very difficult for an MD. They virtually have no solutions. My assistant changed his bandages and also applied the external herbs. The smell was putrid at the beginning. Imagine how big the wound was if I could see his tibia. Luckily, with taking and applying the herbs, his muscles grew back slowly. We can definitely treat this, and it's one of the strengths of Chinese herbs. You must take a lot of Huang Shi. Have you noticed that many herbs that tonify the kidneys can also treat Schalke syndrome? Which one, for example? Du Zhang. It can tonify the Shi and also the kidneys. What else? Shu Duan, Ro Gui in small doses. I like to use Guiji instead. If you feel Huang Shi Wu Wu Tong is not strong enough, you can add Tao Ren, Mu Dan Pi, and Fu Ling. Or you can simply add Guiji Fu Ling Wan. This combination will improve the circulation and improve symptoms of poor circulation. Yang Shi is damaged slowly, and in the end, these patients will have both yin and yang deficiency. This exhaustion in yin and yang damages the organs and leads to organ failure. The slow degeneration of organ function is mostly due to stagnation. Also, most practitioners will prescribe cold herbs to treat thirst. Bitter and cold herbs damage the yang. Does anyone know if Duzhong's property is hot or cold? Bitter, warm, and acrid. Why acrid? To move Qi and strengthen the yang. Shu Duan is also acrid, bitter, and warm. Don't merely use bitter and cold herbs. Use acrid herbs to help regulate Qi and bitter herbs to clear heat. And warm the interior to prevent potential damage to the organs. Let's review this chart. From kidney yang jing deficiency, when does type 1 diabetes start? In teenage years. Acute cases of high fever due to a common cold can lead to complications. This heat can damage the pancreas and lead to type 1 diabetes. As time goes by, yin deficiency and heat cause diabetic symptoms to appear around the age of 30 or 40. Why is it that TCM focuses on spleen and kidneys, while Western medicine focuses on the pancreas? Did you study the pancreas in TCM school? No. Which organ is synonymous with the spleen? In both the Neijing and Nanjing, who can tell me how to specifically treat and differentiate the stomach, small intestine, and the large intestine? According to the Neijing and the Nanjing, what are the differences among the large intestine, small intestine, and stomach?